So just to recap on that, President Cyril Ramaphosa addressing the nation in 2 hours' time, or it's about an hour and a half now, to discuss developments in relation to the country's response to the coronavirus pandemic. The address follows meetings in recent days of the National Coronavirus Command Council, the President's Coordinating Council and Cabinet. Government is set to make an announcement on South Africa's lockdown restrictions this week as the country continues to battle with a second wave of COVID-19 cases. So South Africa moved to an adjusted level 3 lockdown on the 28th of December last year, including further restrictions on the sale of alcohol, a stricter curfew and limits on gatherings. Professor Mosa Moshabela is acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. A very good evening to you, and thank you so much for taking the time to speak to us, Professor. So from your point of view and informed by the research that's been done, not only at your institution, but that's been coming out from other places globally as well, what should be our main priority at this point in curbing the spread of COVID-19? More pointedly, the second wave, the variant that we've seen?
Yeah, good evening, Tsepiso. I think that at this point, what we are seeing in South Africa in terms of the exponential growth of infections, and when we compare with what we are seeing in other parts of the world where they are also having a new variant, we are seeing that because of the increased transmission of this particular type of a virus, it is always possible that the number of infections that we are seeing can increase. So we've kind of gone up to 22,000, but that may not be the end of it. And I don't mean to be alarmist here. I just want to give, examples like in the UK where they are already seeing 60,000, 80,000 infections a day, and they've got a population size similar to ours. Yes, we may differ in other characteristics, but both countries are very concerned about the variant and its transmissibility. We are seeing accelerated infections in Ireland, and also several countries that have gone through their second wave and they peaked. And as the peak was coming down, it shot right back up again. So there is no certainty in what we are going to go through with the second wave, that when we reach the peak, we will be able to go down as we did with the first wave. So everything here needs to be approached with a lot of caution. I think that the main priority here should be to stop new infections.
So let's talk about how to do that, Professor Moshabela, because one thing that you scientists have said from the get-go is that the only thing certain about COVID-19 is a certainty around it. You've just mentioned countries that are experiencing high levels of infection rates. We hear that China, for the first time in 5 months, has had cases that are alarming just in terms of the exponential rise at it in Hubei province. So they thought at some point that they had knuckled down how to prevent the infections. So how do we do that? How do we... especially when the modeling itself is uncertain because everything just moves so quickly?
Yeah, no, certainly. For South Africa, it's very difficult, especially because the reality is that we have to really protect livelihoods. And, in December, when we moved to level 3 restrictions, I thought that it was a good compromise between concerns around livelihoods and the economy, as well as the concerns around the public health and infections. And it might work, I think, for some provinces, especially the provinces that are big geographically and are spread out, hopefully for KZN and other provinces as well. But I'm very concerned that it might not work so much for Gauteng, where people are sort of very densely populated. And the transmissions there, it's expected to be really high based on what we've seen elsewhere. So I think that level 3 restrictions, to be fair, from a public health point of view, may not be enough at this point. But I also recognize that it may not necessarily be something that we need to do everywhere in the country. Some of the provinces have coped and are likely to cope well with level 3 restrictions. My sense is that, for a place like Gauteng, it could benefit from a level 4 restriction. But again, that's our economic hub. So it's a very difficult position we find ourselves in. I would recommend that even if we stay, at level 3 restrictions a little bit longer, which we should, based on what is happening at the moment, until we have peaked and until our infections are showing a downward trend. And I think Gauteng might be able to peak in the next 2 to 3 weeks. When it does, we'll get a good indication. So I would suggest that, people who can work from home as much as possible, they work from home and they don't necessarily go out and engage, with social contact that poses them at increased risk.
So with that in mind, and you mentioned earlier on that you don't want to be alarmist, so people need to take seriously just how much danger exists out there. There are those who are saying it's possible that we could face a third wave, which other countries are said to be facing. That there could even possibly be a fourth wave. So given the fact that we have also such limited information on the reproduction of COVID-19, but more so now the variant, is it advisable to reopen schools?
Yeah, so for me, I think that, the reality that we have in South Africa is that what we need is going to be the vaccine, and it is going to help us avoid the risks of the third wave, which if it's going to come, it will come around winter time, or it will peak around winter time. But of course, we thought that the second wave will come in January. It came a little bit earlier than that. My sense is that the lockdowns and the strict restrictions are not sustainable for long. They help in the short term to break transmission and infection. But for as long as we are not going to engage in a medium-term plan as South Africa, it will be very difficult. We need to make sure that people are empowered to protect themselves and those around them. And these techniques and skills, they come from the area of health promotion, which we are very weak in South Africa around. And with the mistrust that we have in the country, it's not easy to institute behavioral change interventions, which is what was tried in 2020, and it didn't quite work well. But that's our best bet in terms of releasing some of the restrictions, but also being able to move forward. We have to do this collectively, but people need to know exactly what behavior changes involved, and government and other authorities need to make sure that we create conditions for that, which we currently don't have.
Thank you so much for your time and your insights. Professor Mosa Moshabela is Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Of course, the President, through his Command Council and other various stakeholder groups, has been getting the expert opinion from various quarters. How this will be reflected, we'll see later on when he makes that announcement at 8. And just before that, 30 minutes before that, in the next hour, we'll be speaking to political analyst Professor Lisiba Defon, Senior Research Associate at the Institute for Global Dialogue, Sanusha Naidu. And so we spoke about that, what the President would have to consider, but how would he then lay that all out, given the push and pull factors that impact on that, and how do they in fact influence that decision making?